If I were a therapist in a private practice, this is how I would use AI.
All right, bring it.
I would have every client get their own file.
I don't think this is going to end well, but continue.
And then right after every session, I would sit down and I would talk to that file. I would not type, I would talk. And I would tell Claude what we covered.
So this already exists to a great extent, in particular, integrated into health record systems. For example, the one that I use actually has an AI note taker. It listens to your entire session and then writes out a full integrative chart note that includes pretty much everything that you have just shared here. But there is a key difference. You're talking about using Claude. And I already have concerns about the ones that are integrated into our healthcare systems that I'll talk about in a minute, but Claude is not a HIPAA compliant AI system in any way. And what you're talking about is a chart note. That's what we consider chart notes as therapists. So you are entering that protected health information directly into an AI that does use anything you chat about for training data and does not store that information in a way that is covered by what we call a BAA, a business associate agreement, that ensures that there is a log and safety for that information that is aligned with the best practices for making sure patient information is secure.
Then later I would ask, based on everything I have told you about her, which tool in my toolkit fits her best right now?
This part is something that's not usually part of our systems yet, and I think for good reason, because that's part of our clinical judgment and not simply jogging memory in my view. It opens up a whole can of worms for therapists who rely too heavily on the feedback they get to implement things that could actually be harmful to a client, and well, we've already seen things like that happen in other fields and even in physical medicine.
No names, no details, just like themes.
So this part I want to talk about a little bit more. Even when you just redact the names, that doesn't necessarily privatize the data. A lot of those details can be so specific that you are ostensibly sharing the private health information, even if you redact the specific patient identifier.
And I would say, what patterns are showing up that I might have missed?
Honestly, that's part of the job, and it is something that comes up when we do our clinical notes, which brings me to my final concern about clinical notes and AI in the first place, which is taking that activity away from us and handing it off to AI, I think is going to be extremely detrimental. I refuse to use it because the note-taking process itself is where we organize the themes and start to see things that we might have missed in session. Now, I get the desire to have AI make our lives easier, and I see that it's coming, whether folks like it or not. But at least in my view, this is exactly the kind of situation where we don't want AI to be helping. Have your AIs help with other things in your life so that you can focus more on your clinical work, not to replace the clinical work that we are there to do.